We vaccinated our first patient December 14th, 2020. That probably doesn't mean a lot to anyone except that this Monday is our 6-month anniversary of that. And a lot has changed in the last 6 months. My life has changed a lot in the last 6 months for a lot of reasons. And I think everyone else's has too. But, there were some guiding principles that are really important. We talk about equity. I'm not, it's a word that's used a lot, but equity is a big word, but it really refers to things like fairness, justice, and it's harder to achieve than it should be, quite frankly. But there were some guiding principles in our vaccine rollout. It had a lot to do with safety. We wanted to make sure we had effective vaccines. We really wanted to minimize morbidity in the beginning and mortality. In other words, when we started this in the beginning, it was really about keeping people out of the hospital, keeping people alive. And we tried to make our distribution as efficient as possible. I think you saw that it was a pretty efficient distribution, really, quite frankly, is. And we want to make sure we had access to everyone in the state for vaccine, even those who didn't have transportation. So we've done home vaccinations as well. This is a little bit of an agenda I'm going to run through with you today. And we'll get through this pretty quickly here. I just like to go back and talk a little bit about the disease, though, because I think so often we talk about the COVID disease, but people kind of forget how odd a disease it really is. It really started off in the Far East in December of 2019. And quite frankly, if you're like me, it was sort of like, oh, something going on in the Far East in December 19. It's like, well, maybe it's something, we'll see, right? But I think a lot of us thought about the first SARS, severe acute respiratory syndrome. And since it didn't affect us in our country, I don't know that we really had as much attention paid to it. But one of the things about this virus that made it successful at causing a pandemic, and I think that's something to really grab a hold of, is that it had a wide range of symptoms, but it was that incubation period of being 2 to 14 days, that long time, and then spreading virus before you were sick and having enough disease that would kill enough people. This is what made it a pandemic. When you look at the symptoms, one way to think of the symptoms is you could look like someone who had a head cold, runny nose and cough. You could look at someone who had the flu. Oh my gosh, I feel like I got run over by a truck. Or you could look like someone who had a stomach flu, like you have vomiting and diarrhea. And it's like, it looked like all three of those diseases. So again, part of what made it problematic was it looked like, gee whiz, any kind of viral infection. So that was part of how this virus got to be a pandemic. And obviously there's people who were higher risk than others. So, I'm not going to read the list to you, but there was just a lot of people with underlying health conditions. And you really think about this, it's like, it's a large chunk of our population, by the way, that has underlying health conditions. There's just a lot of people who have, quite frankly, underlying health conditions. And I don't know that people think of pregnancy as an underlying health condition, but it is. And I don't know if people think about being overweight or obese as an underlying health condition, but that's far too common a problem that, quite frankly, got worse for a lot of us during the time of great quarantine, where we're all trying to stay at home and working from home. And I'm working from the office today, which is a little bit healthier for me sometimes because there isn't a refrigerator in my office, at least not anymore. Other issues like Down syndrome, HIV, people with who are immunocompromised. These are all just examples of things that made some people much higher risk. When we talked about planning for the pandemic, one of the things people had to do was really just do some planning in their home. Like, in other words, people had to do some things to make sure they had a stable supply of their own, just basic needs to make sure they could survive through the pandemic. This is just an example of where we were with cases. We're actually at a point now where we've had about 150 cases in the last week or so. Once we get below 110 cases a week, that puts us in what's considered low prevalence. That's a really good spot to be in. So we're heading in the right direction. But, it's way, way too many people who've got this infection and just way too many deaths. Those are all decreasing. Like, we're really seeing our case counts come down. We're seeing our folks in the hospital come down. There's about 40 people in the hospital right now. And we're really seeing, one or no deaths per day at this point. So we're really on, I think, the better side of this pandemic. I do want to just remind folks about how the virus gets transmitted and why we care about variants. Because I think this is really why it's still a state of emergency for Rhode Island, is because there's variants that we're concerned about. So keep in mind, it's transmitted mostly through respiratory droplets. And if you're someone who's like, gee, I don't really know what respiratory droplets mean, it's if you go out on a cold winter morning in New England, you go pick up the newspaper or just go outside to get that fresh air, you'll see your breath and you'll see it steam up in front of you, like, oh, there it goes, right? Well, those are respiratory droplets that freeze and then they're in front of you, so you see them. So you can say, well, gee, I know what respiratory droplets are now. That's great. But it also spreads through aerosolization. Aerosolization means it gets suspended in the air and stays there a little bit. Depends on the size of the droplet or the viral particles, how long it's suspended in air. It depends a lot on ventilation. So the more highly ventilated your room is, the less likely viral particles will stay in the air. That's why ventilation was such an important thing. Viruses do change though, and that's not shocking. If a virus changes enough, it could become what's called a variant of concern. So a variant of concern means that it's more transmissible. In other words, more contagious one person to the other than the wild type SARS-CoV-2. And the one that's the original is called the wild type. In case you're curious, I didn't make that term up. That's what it's called. But wild type is the original, if you will. And variants of interest are, as far as the virus is concerned, quite frankly, new and improved because it's going to transmit a little bit more effectively. And keep in mind, viruses don't want anything. They're viruses. They're just little strands of ribonucleic acid. They don't have a brain. They don't want anything. But viruses that can transmit more easily from one host to another host are more likely to survive and persist. And that's just a thing to think about. It's like if they're more transmissible, they're more likely to continue on. And they're looking for what are called susceptible hosts. A susceptible host is someone who hasn't had the vaccine or hasn't had the infection recently. So it's important to understand that the variants of concern are a term. Those are the ones that are more transmissible and cause more severe disease. Now, there's other terms. Another term is called a variant of interest, which is something that's being studied that might be a threat. There's another term called a variant of high consequence. Right now, there is no variant of high consequence in the United States because that would mean it's a variant that is not addressed by monoclonal antibodies or by the vaccines. So that would be like starting all over again. That would be a big problem. The variants that are common in the United States and really common in Rhode Island are the P1 variant and the B1351 and the B117. And it just, I don't know if those letters and numbers mean anything. It's just that they're named based on some of the changes that occurred. There is treatment for this, though, and I think it's important just to have that context is right now, there is monoclonal antibody treatment for COVID-19. And the earlier you do the treatment, the more effective the treatment is. So if someone is 12 and older or has any underlying health condition, they could be eligible for treatment. Now, there's a few sites in the state that are doing it. It's intravenous infusion. It's not like every doctor's office is doing. So AtMed Urgent Care is the place that's doing most treatments. So AtMed Urgent Care is one I would think about. And that's the place where they do most of the treatment. There's other places that will do testing for folks, but quite frankly, testing is easier to accomplish at portal.ri.gov because at portal.ri.gov, you can probably get the test done the same day and the result back either the end of that day or the next day. It's the last time I was tested. I went over as soon as they opened and I had the result that night. Let's talk about the vaccine. That's why you wanted me to come. So vaccination right now is 12 and older because the Pfizer vaccine was approved for people age 12 and older. So that's important to understand. The Moderna vaccine is 18 and older, as is the J&J, which is also called Janssen. And quite honestly, I don't know why they have two different names next to it all the time. It would be nice enough just to call it the Johnson & Johnson vaccine. But it turns out Johnson & Johnson owns a subsidiary called Janssen, and Janssen is the one that actually developed it. So that's just why it's that way. But Johnson & Johnson's been around forever. They make baby powder, baby shampoo, and all kinds of stuff. Band-Aids for that matter. Janssen makes pharmaceutical products. There's a lot of prescription drugs that are out there. If you've ever heard of Imodium, an anti-diarrheal drug, that was made by Janssen. So the vaccines are safe, highly effective against serious illness and reduce the risk of infecting others. And it helps us against spreading. One of the key things about variants is if you just keep this one law of virology in mind, and it's just important, it's 100% agreed upon law of virology, is that a virus will not mutate if it can't replicate. So that's important to understand. If a virus isn't replicating, it's not mutating. If it's not mutating, it's not creating variants. We all get to go live happy lives again. I just think it's important to understand, why do we care so much about stopping the spread? Not the least of which is we don't want people to pass away or end up in the hospital or be sick, but we want to stop risking variants. Some of the differences between the vaccines is their dosing frequency. The Johnson & Johnson vaccines, one dose. That's the one that had the concern about blood clots. They were pretty rare. About one every 500,000 people got these blood clots. There was a pause in its distribution. And the pause was there for a couple reasons. One, so they could stimulate and get more responses and see if there was more cases out there. But the other thing was, gee, guys, you got to make sure the medical community knows that don't treat people with heparin, because when you get a blood clot, that's one of the first things we do is treat people with heparin. But because heparin-induced thrombocytopenia was the problem, in other words, getting all these platelets clumping together and forming this one big clot, it's a bad thing, right? In other words, we got gee whiz, we got a clot, and it's from this. So there seemed to be a connection. So they did a pause, and so that vaccine's available. But it's really important for people to understand the risks and benefits with their physician before they go do that. We don't see that problem with the Moderna vaccine or with the Pfizer vaccine. Now, those are both multi-doses vaccines. So the Pfizer one is at least 3 weeks apart, and the Moderna vaccine is at least 4 weeks apart. And it's okay if it's a little bit longer. We really don't want to do it all that much quicker. If it's a day or two quicker, we don't get upset about that, but we really don't mind if it's longer. We'd prefer people to get it at the right time, 3 weeks and 4 weeks, but life is life. There's only so much we can make people do. Right now, about 96% of people, 96.5% of people in Rhode Island have gotten the second dose. So we're seeing pretty good uptake on that. That's pretty impressive. Let's talk about vaccine safety. So it's the vaccine production is highly regulated. There's a lot of monitoring that occurs after vaccines are created. This is true for all vaccines. The SARS vaccines had expanded monitoring. VSafe was created, which is a program people can use after they get the vaccine. And there's other post-marketing surveillance that goes on. So if safety is our top priority, I think it's important to just make sure we understand this. This vaccine, there weren't steps that were skipped. In other words, it went through quickly, but it wasn't like steps were skipped. It went through the same phase 3 clinical trials that every other vaccine goes through. So I don't think of it as being rushed. I think of it as being prioritized. And I think that's what you really think back about what happened in the United States is science really put all their efforts into creating these vaccines. The federal government got around the funding idea of this, and this was important. So I don't know that calling it Operation Warp Speed was the greatest idea in the world, but Moderna was an Operation Warp Speed vaccine, whereas Pfizer just developed their own with a German partner called BioNTech. So they had large clinical trials, tens of thousands of people, and they went through the same process every other vaccine has gone through. So getting vaccinated is easy. I mean, quite frankly, you can literally walk into one of our vaccine sites without an appointment, and they're happy to have you do that. You can go to vaccinatedri.org. You can go to vaccines.gov. You can go to CVS, Walgreens, Walmart, Stop and Shop. Almost everywhere we have a vaccine, it's now no appointment necessary. I mean, anybody can just approach them and just say, I'd like to get a vaccine. And that's a far cry from where we were. But, starting the end of April 2021, that's where we became. It was the end of April 2021 where supply exceeded demand. One of the things that helped move Rhode Island in that direction quicker was we were able to get vaccine in a higher quantity than what our original allotment was, because the vaccine demand wasn't as robust in the southern part of the United States. We were able to acquire a vaccine that wasn't being used in other parts of the country. So it was actually the end, about April 21st, 22nd, when we really noticed that supply exceeded demand, which in some ways was a very welcome relief for people like me, as we were juggling through from December 14th to the third week of April. Quite frankly, just getting that demand met, because the demand for a lot of the vaccine was just ferocious. I mean, ferocious in Rhode Island, which was great and indicative of our desire to get vaccinated. These are some of the places. Sockanaset is in Cranston, right across from Whole Foods. The Dunkin' Donuts Center is still open. Former Benny site in Middletown. The Sockanaset site will be open the longest. Like, there's no plans on closing the Sockanaset site anytime soon. Other mass vaccination sites have been closed already. Part of that is because there just isn't as need for as many, because so many pharmacies are doing it, and now doctors' offices are coming online. And this really gets to a larger strategy from the Department of Health. Why it was so important to get doctors' offices to be available to do this is we're really trying to return the pandemic eventually to the usual practice of medicine. So we want to eventually move testing back to doctors' offices, vaccination back to doctors' office, just like you would for everything else. We want to normalize the pandemic like we do for everything else. We have a vaccine locator, and that works fine too. A little instructional video on how to acquire that. But I think, really finding a vaccine isn't nearly as big a problem as it used to be. This is just an illustration of how you can find a vaccine site throughout the state and how you can use the vaccine locator. It is available in multiple languages, including English, Spanish, and Portuguese. But quite frankly, you put in your zip code, and this is at vaccinatedri.org, and then you get your site. It's interesting. Vaccinatedri.org served as a waiting list in the beginning. I remember when my kids signed up for it, it was just easier than constantly looking for an appointment. And as soon as it became available for their age group, the computer generated appointments for them. So that was kind of fun for us. So my kids are all fully vaccinated. All three of them are. So vaccine confidence, something I just want to spend a little time on next. It's really important for us to just have the facts about vaccine, because there's no shortage of information I have found, especially when you get on to digital media. It's just interesting how much is out there that maybe is or isn't true. So some of the key concepts is that the people who are vaccinated are highly unlikely to die or get sick from COVID. Right now, when you look at who are in the hospital, one of the things we're seeing is well over 90% of the people in the hospital are unvaccinated. If you're in the hospital because of COVID, over 90% of those people are unvaccinated. Some of them are partially vaccinated. Very, very small percentage are fully vaccinated. So the vaccine is working very well. So over 160 million people, around 170 million people right now have gotten the vaccine, at least one dose. Over 100 million are fully vaccinated. And we've gone over 1 million doses in Rhode Island. It just shows you this is really a very common thing. Rhode Island has already gotten over 70% of the population at least one dose, and over 50% fully immunized. So Rhode Island was one of the first states in the country to hit that goal set forth by President Biden. And we'd like to go as high as we can. One of the things we're also doing right now, call it vaccine tourism if you want to, but we lifted our restriction that you had to be someone who lived, learned, or worked in the state to get a vaccine. So if you're a tourist in Rhode Island and we have a pop-up clinic by a beach, you want a vaccine, we'll be happy to give it to you, because we recognize there's a larger responsibility here. Other things that we've done recently, we just had our first drive-through clinic, which was kind of fun. Over 100 people came last Saturday to the Fidelity Smithfield partnership we had out there. And people just like staying in their cars. And I think people like the privacy of being in their car, not being around other people. So I think people really like that. So we're going to do more of those. One of the things that we just have to really get out in the open, though, is the vaccine cannot give you COVID-19. And there's no reason to believe it would affect anyone's ability to have a child. And it cannot change your DNA, your deoxyribonucleic acid. It can't do that. So those are myths that came out early in the pandemic. There was other myths, too, that you couldn't drink alcohol. If you get the vaccine, that's also wrong. Not that the Department of Health is suggesting anyone drink alcohol, mind you, but quite frankly, there is no problem with that. So in other words, it's a very safe and effective vaccine. I want to talk a little bit about some of the issues we've seen with COVID-19 and mental health, just to recognize that there needs to be support for this. When I'm not working for the Department of Health, I'm a pediatrician. One of the things I've noticed over the last years, I've prescribed a lot more Lexapro than amoxicillin. So I've been prescribing a lot more anti-anxiety medicines than I have antibiotics. Just interesting. I'm just not seeing sick kids anymore. It was the first year, I remember my 31-year career, I didn't see anybody with really the flu. I didn't see anybody with respiratory syncytial virus. I didn't see one patient with these problems, which has never happened before in my 31-year career. And I think because of all the public health measures we did, we just didn't see as many people who are sick. But I think one of the things we have to acknowledge is we did see a fair amount of anxiety, a fair amount of depression, not just among teenagers or children, but among adults as well. This has been a population trauma, a very substantial population trauma for everybody. I think people have to process, what happened here, because the whole planet went through the same thing together. And I say this too, I think there's a temptation in the United States to think that the pandemic is done. It isn't. But when you look at different parts of our planet right now, it really is, they're in just terrible shape right now. Africa, which is a huge part of our planet, over 1.2 billion people live in Africa. Much less than 1% of that population is fully vaccinated. So you still see parts of the planet really struggling with the pandemic and still haven't gone through their peak. And it just makes you just really cognizant that this is a global pandemic and we really need to solve it globally, which makes me happy that I see the United States is doing what it can to provide vaccine to other nations, because we really have to get the whole planet over this disease. Some of the resources we have, though, is BH Link. It's a phone number anybody can call. 414-5465 for anyone 18 or older. And if you just need crisis support, that can help. A lot of times talking to your doctor is a good idea too. But I think it's important to acknowledge that this has been a very anxiety-provoking pandemic for all of us. Kids Link is available for people under 18 at 855-543-5465, which is another resource people can avail themselves to as well. I want to stop here and stop screen sharing here because really this is supposed to be a question and answer session. And I just wanted to spend like 25 minutes or so chatting with people, give you some ideas so we can really just prompt some questions there. And I'm sorry, Carmen just said, I missed this, Carmen, because I was showing slides. I do talk fast, Carmen. And to the interpreters, I'm sorry. That's my New York side of me that talks fast. Grew up in a family with 5 brothers. If you want to get a word in edgewise, I learned early I had to get my words out quickly. So I'm not blaming my brothers, but they're at least partly responsible. So Mark, let me stop there and let's answer some questions. I'd love to.
Yes, very good. And I'd like to remind our audience that you can submit your questions by clicking the Q&A button. If you're with us on Zoom, you can type your questions into the chat. If you happen to be watching the live stream as we're kind of broadcasting this on the RIPIN YouTube and Facebook pages, and you have a question there and you watch, feel free to just type it into the comments. I will relay it to Dr. McDonald, who will do his best to answer your question. I know that we also want to mention before we close out today that, you know, Dr. McDonald mentioned these drive-through vaccine opportunities. RIPIN will actually be hosting a drive-through vaccination clinic in the parking lot at our offices at 300 Jefferson Boulevard on Saturday, June 19th. And I think we might have someone on the webinar today who can talk a little bit about that as well. But looking at the audience, one question that's just come in, what do the numbers look like for 12 to 16-year-olds being vaccinated?
Yeah, demand looks good in that space. In other words, we're not quite at 50% of that age group getting vaccinated yet, but we're well on our way there. To me, it's one of the things I was curious about, like what would demand look like? But it's interesting how demand was pretty brisk in that area. And this is one of the things I was talking to the team about this morning. What we're really seeing as we open up to new age groups, that's when you really see a spike in demand. So, but when you look at that whole 12 to 20 population, we're about 52%. So we're heading in the right direction there.
All right, very good. Now I'd also like to take a second, and I'm going to bring on another member of the Rhode Island Department of Health Youth Advisory Council. This is a group of youth, young adults, and we have, I know, at least a couple of questions from them. So I'm trying to see if I can get Alicia. I believe Alicia is here. Can you hear me, Alicia?
Yes, I can. Hi.
Hello, hello. Please go ahead with your questions.
Of course, of course. Thank you for having me. And one of my questions is just, does the vaccine have long-term effects? And actually, would you like me to ask all 3 of them now or just one at a time?
Let's go one at a time.
Okay. My first one is, does the vaccine have long-term effects?
Yeah, so Alicia, do you mean long-term effectiveness or long-term side effects or both?
Side effects. For sure.
Yeah,
Side effects.
So the vaccine doesn't have long-term side effects. Quite frankly, no vaccine we have does. I think it's an important point to think about. It's like, if a vaccine has a side effect, you usually experience it right then there. The COVID vaccine, it's kind of funny. We're used to the term side effect, but really when you get the vaccine, it's mostly an immune response. So in other words, if you get the vaccine, it's likely you'll have a fever, your arm's going to be sore, you might have some body aches, other things that might go on as well, but that's pretty much what happens. And part of why I say it's an immune response is this is what your immune system does. Like, for example, when you normally get sick with a virus, we've all gotten sick with viruses, right? The virus runs around your body for several days before your immune system actually figures out it's there. And then by the time your immune system figures out it's there, you get a fever, you might get shakes and chills, your muscles might ache, but it's an immune response. And what you're really feeling is the inflammation that comes from your immune system responding to the virus. And what I mean is when your body makes the white cells that kill the virus and all the other things it does, that's what you feel is your body fixing all those problems. So that was a long answer to that question. What was your next question, Alicia?
Yes. So given the fact that COVID came at us as such a rush and it was so sudden, do you feel that the amount of time we had to research this vaccine and come up with a reliable vaccine was enough time? Do you think the length of it all was enough time?
Yeah, so Alicia, it's a really fair question. So the vaccine wasn't rushed. What was interesting is it was new technology like messenger ribonucleic acid vaccines were new, but the technology has been there for over a decade and was originally developed after the first SARS, severe acute respiratory syndrome 1. So it wasn't rushed, it was prioritized. So, and I think what you saw was a lot of scientists and pharmaceutical companies and others working together, trying to get this thing right away because it was a global pandemic. So, and I think to me, one of the things I thought was very exciting about this was, one, to actually have the science move this quickly was possible because of so much other technology that occurred. There's a reason why we invest in basic science, right? Like I graduated medical school 31 years ago today. So not that that needs to be celebrated by anybody other than me though, but it's kind of a fun little anniversary for me. But 31 years ago, you couldn't sequence a genome. In fact, I don't even know anybody was thinking about sequencing a genome. But it was interesting, 11 days after the first case was discovered, the genomic sequence of the virus was done. And so when you had that blueprint, it was a lot faster to make vaccines. And I think that's just one example of how the Star Trek technology really is here now. It's interesting. I was down in Disney World a couple weeks ago. My wife and I went on vacation for the first time in a year and a half with my kids. And we're in the Magic Kingdom. And they have this area called Tomorrowland. And I think Disneyland needs to update Tomorrowland because everything in Tomorrowland is happening already. But just as an illustration of how a lot has changed in science. So I think the vaccine was prioritized. That was pretty much what happened there. It wasn't rushed. It was just prioritized.
Yes, thank you. That was perfect.
All right. Were those all your questions, Alicia?
Yes, it was. Thank you.
All right. Thank you so much. So we have quite a few other audience questions, and I'll try to get to as many as we can. One question is, do you have any idea when the vaccine will open up for age 12, under 12?
I think August or September is my guess. I think Pfizer will come before Moderna, but they're both doing the research right now. One of the things that's interesting about their studies, though, is they're looking at different doses. So right now, when you get a vaccine, it's 30 micrograms. But Pfizer is looking at 10, 20, and 30 micrograms to see if they can have a smaller immune response, but still have an effective vaccine. So we'll see if that happens. So I think August or September, we'll see it for younger people. I would not be surprised if you saw 5 and older open up before you saw 6 months and older, because I think that's pretty much where the research is going right now. So I would think that's what you're going to see first is 5 years and older. And really, if you're wondering why does it take time, because you have to give the vaccine, you have to recruit patients, you have to give both vaccines, and you have to follow them for a period of time. And it's really about of comparing, like, well, they don't know if they got the vaccine or got, the saltwater placebo injection. How many vaccine people got ill versus how many in the group that got the placebo? When you looked at the 12 to 15-year-old data from Pfizer, it was staggering that 100% of the people who got the vaccine did not get sick. That was staggering. Just don't see that. So next question, please.
I had an episode of transverse myelitis, this being an autoimmune reaction. Would the vaccine be recommended? Yeah,
I think the vaccine is still recommended. I think if you have any question, I would talk to your doctor about that. Like I'm not at all concerned about you getting the vaccine. I'm more concerned about you getting COVID, quite frankly. So I would definitely get the vaccine. But if you have questions like that, it's fair to talk to your doctor. One of the things people say to me, though, just to be really fair in that, the doctor will say, I'm not really sure sometimes. And so then they actually call me. And one of the things I'll just say is it is a new disease. It is a new vaccine. So sometimes they actually call the health department to say, what do you think we should do? So that's why I just tell you, I'd go ahead and get the vaccine. I sure would. I wouldn't think twice about it.
Okay, very good. What are side effects that we are seeing in Rhode Island with this age group? So with this newest age group that's opened up, 12 plus, are we seeing any different side effects with those younger patients?
Yeah, the immune response is what you're still seeing. So it's similar. So you're seeing, 12 to 15-year-olds with a fever. Most common is a sore arm, by the way. And then some kids are just tired the next day or kind of wiped out, and you sometimes see more of this after the second dose than you do after the first dose. Headache happens to some. And that's just something that, you put in the back of your mind. One of the things that's interesting about the teenage population is, and this is true for all vaccines, this is part of why you want teenagers to be observed. Everybody should be observed 50 minutes, but they're slightly more likely than adults to actually just pass out, and I think that's just something that happens with all teenagers when it comes to vaccine, have what's called a vasovagal response. That's one thing about 12 to 15-year-olds that you see, but it's still not that common. So I wouldn't let that dissuade you from getting the vaccine, but I want to make sure you got a good answer to your question.
All right, very good. Another question here. I have read that for young teens, one reaction can be a cardiac issue. Is this true?
Yeah, so there's a question out there right now where, and this is what happens when you have a really robust monitoring system for a vaccine. So one of the things that has been detected in Europe and to some degree in the United States is some people have a vaccine and then they have myocarditis or pericarditis. Now, the heart is a muscle. And whenever you hear the word itis after anything, it means it's inflamed, right? So you hear the word appendicitis, that means your appendix is inflamed. So, myositis means your muscles are inflamed. Well, myocarditis means the heart got inflamed. Pericarditis, the pericardium is a sac that covers the heart. So that's inflamed, it's called pericarditis. But it turns out those are seasonal viruses that cause that infection. So you tend to see an increase in myocarditis and pericarditis in March, April, May, June, July, time of the year we're in right now. So there's been an increase in myocarditis and pericarditis, and there's some question, is it connected to the vaccines? Right now, there does not appear to be a causal connection between that and the vaccines. But since we have such a robust vaccine adverse event reporting system, we're seeing these cases. So when you talk to the Center for Disease Control in Atlanta, they're not seeing more cases than what we would normally expect this time of the year. But there is that temporal or time association with some people getting a vaccine. So it's something that's being studied. The CDC, the Rhode Island Department of Health, and myself are both telling everybody, I wouldn't let that stop you from getting a vaccine. I would go ahead and do that. But that's the answer to that question. It's something we're still looking at. But I think it's more so, if you look at the cases that are being described right now, they're more so 18-year-olds and older, not the 12 to 15-year-olds. So it's still, again, something that's being looked at, but there's no reason to believe there'd be a connection. Like, one of the things you look for what's called biologic plausibility. In other words, it doesn't make biological sense. Why would you have gotten a vaccine and then have an inflammation of your heart? The receptors aren't connected there. It isn't the same. So I'm not, we're not sure how it's all going to pan out, but my guess is when it all pans out, it's just going to be temporally related to a seasonal variation, but it really wasn't connected to the vaccine. It's my guess how it's going to turn out.
Okay, very good. Here's a good question. Will the vaccines be available as part of the immunizations given during the Rhode Island school clinics that are held in the fall?
I hope so. We're giving them in schools right now, and we would actually like to have them done beforehand. So we're actually in as many schools as will take us right now. So if there's still kids who haven't been vaccinated by the fall, which I think there will be, because I think the vaccine will be eligible for kids 5 and older by the fall. It's my hope that I hope to be in schools. The way we're doing vaccines in schools, though, just so you know, it's not like we're taking kids out of class like I was a kid, right? I got taken out of first grade class, walked in the auditorium with every other kid, and we get the vaccine shot in the arm, right? And we don't do that. It's a clinic that occurs at night. Parents can come. It's a very nice experience. So it's not like your kid's getting a vaccine without you knowing it.
All right, very good. So here's another question. My 16-year-old child received the Pfizer vaccine in April. She had minimal symptoms, minimal side effects. Then she had the second dose and was in bed sick for a few days with a fever. Will she need an additional booster for COVID in the future?
Yeah, so that's what's called an immune response. And that's a great example of that second dose sometimes gets you a little bit more of a response than the first dose. And that's more than what most people get. But there's no reason to believe that person would need a booster more than anyone else would, because, to some degree, what you've learned about that person was, well, you had a really good immune response. So your immune system really learned that exposure. As far as anyone needing a booster, because I think that's really another question, but I think it's an important thing to talk about, is I don't know if anyone's going to need a booster yet. We don't have that information yet. And the reason people would need a booster is, do you remember when I talked earlier about variants of concern? So if we get another variant that looks like it's occurring that isn't going to be protected by the current vaccines, and right now, the variants of concern that are in the United States, the 3 that are most common, the vaccines all give really good neutralizing antibody to that. So we're still seeing really good effectiveness of our vaccine. But if we start to see variants where the vaccines are not effective, then you're going to want a booster dose. And right now, I know Moderna and Pfizer are working on booster doses. I expect if they, have to have them, they'll be approved a little bit quicker because they already have a method for doing it and already know how to make it. I don't think we'll see nearly as much shortage of vaccine as we will if we have to have a booster, but we don't know yet. So we'll have to wait and see. But, right now I'm still just trying to get everybody at least one time around the vaccine table before we start serving dessert, if you will, or seconds. All right.
Very, very good. And you kind of just maybe answered this question a little bit, I'm not sure, but this is a question that I've got here that I think you hear a lot. Asking is the severity of the reaction you have, the side effect symptoms, reflective of the strength or health of one's immune system? You hear that a lot, like, oh, it really laid him out. He must have a good immune response.
Yeah, you definitely had a good immune response, but don't read too much into that. In other words, if you did not have an immune response, it doesn't mean the vaccine didn't work for you. It just means you didn't have you didn't get symptomatic. So, and that's fine. Your body's still protected. I think it's just important to think about it this way. Keep in mind, you've seen this happen in your own family, right? Somebody gets sick. One of the other kids gets sick. Someone gets sick. And then it just seemed like, somebody had a much harder time with it than the other two did. Well, how is that possible, right? We all got the same virus. How come, Billy was down in bed for 3 days and, Janie and Johnny were fine. They just had a runny nose for a day. And it's just our immune systems are a little bit different, and it depends how quickly they respond to things. So I wouldn't read too much into it. But I don't think there's any reason to get a blood test to prove you've gotten a good immune response. Like, don't run out and say I want an antibody test, because we don't really know that really tells you anything. In other words, there wasn't research done that said, aha, those who had antibodies don't get COVID. That wasn't how the clinical trials were designed. The way the clinical trials were designed was person gets a vaccine, did they end up getting COVID? That's how the clinical trials were done. They didn't measure blood tests. So we don't know if the blood titers actually mean anything at this point. And there's a reason to believe they don't. So I wouldn't go ask for antibody tests.
Okay, very good. Thank you. So here's a question. Someone writes, I have some questions in regard to supporting peers. So we have some members of the Youth Advisory Council here, RIDOH's Youth Advisory Council, and asking, how can youth encourage other youth to get vaccinated? And how can we, as a society, they write, support each other's mental health as well?
So as far as how do we convince other youth to get vaccinated, one is be a role model and get vaccinated yourself and tell people you did it, right? So part of why that's important is people want to know, gee, does someone I know and trust get it? And part of why I say it that way is I think it's really just important to make sure that people understand the power of a solid endorsement from a friend, someone they trust. It's new for people, right? One of the things you should never do is don't do this next thing. Don't argue with people about the vaccine. Don't say bad things, and don't yell at people. That never helps anybody. Like, there's no public health intervention known to mankind where insulting someone or calling them names or getting into a fight actually persuades them to do anything. That's just not a public health strategy. So never argue with people. It just doesn't work. One of the things I do encourage people to think about, though, is like, if people are giving you facts about the vaccine that's not true, ask them for the source. And you can do that a polite way, right? In other words, we're not challenging. We just say, hey, where did you learn that fact from? Because sometimes you're like, they can say, I don't know, I just heard it on, they don't know. And that's where sometimes people can just start getting in their own mind, well, maybe I should think differently about this. And I think this is one way to support people in doing it, but we want to be very nice to people. And one of the things we really want to do is give people the space and time they need to make their own decision. Keep in mind, we gave dose 1 of vaccine in Rhode Island December 14th, just a little bit under 6 months ago. I'm really happy with how Rhode Island did with this. I'm really, really happy with how Rhode Island did. So I don't want anyone to be going around saying, you're not part of the solution if you're not getting the vaccine right away. People need the time and space to make their decisions. And I think just being kind about it. One of the things I think it's also important is like to say, look, can I provide access to you to get a vaccine? Like, if someone doesn't have transportation, can I provide the transportation? Can I be the person who gets you there? And, the Sauconasset site right across from Whole Foods, just walk in and grab a vaccine. They're happy to give it to you. Walk into a pharmacy, happy to give it to you. So if you can do things like helping someone get there, that's another idea. Those are some things. Now, you asked another question about how do we support each other's mental health? And I think that's a different question. One of the things I think we need to do is be honest with each other. We all went through this substantial population trauma. I went through a different pandemic than you went through, right? My pandemic was very personal. Your pandemic was very personal too. My pandemic caused me personal pain every day. Yours did too. I had to deal with my pain a little bit differently than you did, though, because that was my journey. And I think recognizing, one, we have to support each other, accept that, hey, this was a difficult time. Things are getting better. People need to learn it's okay to go out again, right? Like, in other words, I was at a restaurant last night, a retirement party. For the first time, nobody's wearing masks. They're all fully vaccinated. It was different for me, but it was okay. And I felt okay about that. I was on Disney World 2 weeks ago. People aren't wearing masks in Disney World outside. Inside, they all are. But it was fun to be down there, and it was fun to see that. And part of what I'm getting at is doing things that are fun again are important. And kind of one of the things I think people need to do that's kind of fun. Like I said, I brought my family to Disney World. I think you need to do something fun for yourself too. We all need something to look forward to. So some things that are kind of fun to look forward to is like plan a vacation, but there's smaller things too. Sometimes just starting a quest. Find a quest, right? I want to find the best cannoli in Rhode Island. That's a quest. You want to find the best soft ice cream in Rhode Island. That's also a quest. I want to find the best place to hike in New Hampshire. These are things that are just sort of fun things to do. You know, the hike in New Hampshire is a little healthier than the best ice cream. But you know what? We went through a pandemic. We can go find something fun to do. But part of what I think we want to support each other with is find fun things to do together again. And if you can find some fun things to do together again, you build that relationship with each other. And it's just amazing how laughter, joy, and friendship heals so many wounds. So I think those are some tangible ideas of things you can do to make the world a little better in Rhode Island.
Excellent. Thank you. That's great. That's great. Dr. McDonald, do we know, is there any answers yet on how long after the vaccine a person has immunity to the virus?
Right now, it looks like a long time. And I don't know an exact date, so I can't tell you right now, but I think it's a long time. In other words, that gets the whole booster issue right now. So, but right now, we're like, just so you know how we're measuring that, we measure what is called a vaccine breakthrough case. So if someone's been fully vaccinated, had both doses or the single dose plus 14 days, we consider that person fully vaccinated. And we're tracking how many vaccine breakthrough cases we have. And they're very, very few. I think last time I looked, which was a couple weeks ago, was like 0.14%, something really ridiculously small like that. It was just a very small number. So we're not seeing very many vaccine breakthrough cases, but we track that. As we see that going up, it'll raise questions for us locally, but also nationally, because every other state is looking at that same metric as well. This is something we do in partnership with the Center for Disease Control to make sure we keep track of how effective the vaccine is.
Okay. Now, RIPIN as an organization, we provide a lot of services and supports for individuals with disabilities of all ages. One question we have here, are there special accommodations available at the state vaccination sites for individuals with special needs?
Yes, there are. So all of our state sites are ready to handle anyone with any kind of different ability. And I feel like you should just feel welcome there. One of the things I will tell you is that all of our sites right now are moving very quickly and very efficiently. And they're nice people who want to help you. I hear nothing but good things from people who go through our vaccine site. So please do them now while you can, though, by the way, because they won't be there forever. You know, keep in mind, eventually this is going to go back to your doctor's office, and your doctor's office is a fine place too. And right now there's more and more doctor's offices that are doing vaccines, and they should be set up to help someone who's differently abled as well.
Very good. And I think now is a good time to talk a little bit about the vaccine clinic that we're going to have at RIPIN on June 19th. Will be the first of 2 clinics, so you'll be able to get your first and second dose of the vaccine. And I think we have another guest who is going to talk a little bit about how that works and what it looks like. And yes, here's Brooke Lawrence. Brooke, I'm going to turn it over to you if you're ready. But I believe Brooke's just going to kind of show us what the vaccine clinics, another drive-up clinic that we're going to have in the parking lot at RIPIN, and Brooke's going to walk us through what that looks like.
Thank you very much, Mark. My name is Brooke Lawrence. I'm the executive director of the Rhode Island Medical Reserve Corps and a disaster medical assistance team. And a little bit about our organization. We're a nonprofit 501c3 volunteer organization based down in West Greenwich. We've been very engaged with the pandemic response. And in fact, today is day 456 of our response, going back to last March. And we've been involved in many different aspects of the response, from backfilling medical providers at group homes and nursing facilities to field hospital preparedness, as well as many testing operations, whether it be fixed sites or mobile testing. And of course, leading into doing vaccination, where we managed two of the mass vaccination sites in Woonsocket and South County. And now we're doing a lot of mobile vaccination opportunities or mobile vaccination clinics of various sizes at different different venues around the state. So one of that is we're going to do what we call a Vaccine Park at the RIPIN facility at 300 Jefferson Boulevard on June 19th will be the first dose clinic. I'm going to put up my slide here. This is going to be a very easy, low stress environment. It'll be very convenient for everybody to get in and get whomever would like to be vaccinated done. We'll also have some testing ability there as well, with some rapid testing and PCR testing if needed. So that service will also be available. And let me get my slide up here. I just wanted everybody to see the footprint. Bear with me one second. Let's see. Dr. McDonald, are you still sharing your slide by chance? No? So I figure out.
I'm not still sharing, but
Okay.
I have it too, Brooke. Let me see if I can pull it up.
You've got to be and throw it up. I don't know if
Let's see if I have any better luck.
there we go. I've got it.
Oh, great.
I think I had the screen minimized. There we go.
Beautiful. There it is.
All right. This is the RIPIN facility for anybody who has been over to the office there, but it's right off Jefferson Boulevard. You know that you don't need to digest this much, but we just wanted to show kind of everybody that there is a plan. It's going to go very, very smoothly. We do this a lot at all kinds of different locations. We're kind of the austere environment vaccinators, if you will, the Swiss Army knife of public health in Rhode Island. But you're going to enter right off of Jefferson Boulevard. You'll come into the parking lot. We'll have a little kind of a pre-staged area where we'll have a quick interaction to ask if you have an appointment already, and we'll talk more about having a pre-made appointment. If you don't have an appointment, that's fine. We're just going to divide kind of our flow along the parking lot here into appointment-based and non-appointment, because the non-appointment will just take a little bit longer to get the person registered for the vaccination, which is very easy, and we'll help you do that. No problem whatsoever. Once you're vaccinated, you're just going to drive to the end of the road here, turn left, park in one of these spots, and wait 15 minutes. We're going to have a team of our folks there to help with any observation questions that you might have or any issues. And then after 15 or 30 minutes, depending on your individual need, you'll be able to just exit back out and go on your day to maybe start your quest looking for that soft serve ice cream around Rhode Island someplace. I think that's a great plan. I think that Dr. McDonald's words there are very valuable, and kind of finding normalcy through this is important. And I'm taking advantage of that this evening, going to I'm down in Baltimore on some other meetings, but I'm going to catch a Orioles game tonight. So I'm looking forward to being back in a ballpark and eating a hot dog and having a good time and finding some of that new normal. So if you, I think the RIPIN folks have shared the link to the two clinics. But if you would like, these are the two registration links. You can actually just open the app, your camera app on your phone, point it at what's that QR code here. which is the circle, and it will take you directly to the clinic that is scheduled for June 19th at the RIPIN facility. So again, we'll have Pfizer at that clinic, so that would be anybody over 12 years old. So you can simply just register. Pre-register is always helpful. If you have trouble getting registered, we can certainly register you on the day of the event, and we're happy to do that. Very easy to do. Certainly the RIPIN office has this information, so if you reach out to them, they can share that information with you as well. If you have trouble with the QR code, the link for that clinic is right down the bottom of the slide as well, that they can disseminate that information. I believe they have already done that. Once you make your first dose clinic, then just go ahead and make your second dose appointment. We'll be right back to the RIPIN facility on July 10th from 9 to 11 to administer your second dose and get you on the road to immunity. Does anybody have any questions for kind of that day of clinic at the RIPIN office?
Yeah, folks, if you do have any questions, we got about 5 minutes left. Feel free to type them in. I don't see any at the moment, but I'll just go ahead and take a moment to say that this vaccine clinic at RIPIN, which we're so excited to be hosting, it's open to everyone. We wanted to do it though because it is very helpful for individuals who, for whatever reason, may have a harder time getting a vaccination at a state, one of the other large state vaccination sites. You know, individuals with different needs. Not that this will meet everybody's needs, but for folks for whom standing is difficult for a long period of time, for people with young children who have different needs, the sort of park and vax setup can be a lot more accessible for those families. So we're really, really happy and excited to provide that. And I want to thank you, Brooke, for walking us through that just now.
Yeah, and I think it's important too to note that we have a lot of experience dealing with. We did early on a lot of work in the special needs area with clinics that you may have seen at Kirkbride Country Club, and also we've done a lot of vaccinating in vehicles for folks who had a hard time, like Mark said, getting into a building, or it's just more convenient, and a lot of people feel more secure, or it's a more familiar environment. So, this is we're getting to the point with vaccination that we kind of need to bring the programs to the people, and I think we're doing a really good job of that as a state. And this is another great example of that, where we're doing something unique where we wouldn't normally be thinking, this route many years ago. So, the operational, what we say in our group is operational tempo dictates need, and that this is a great example of that, where we have to think outside the box. So we're happy to help, and we're looking forward to having a successful clinic on the June 19th, and then again on July 10th.
Great, very, very, very good. And we certainly really appreciate everything that the Rhode Island Medical Reserve Corps is doing and has been doing. So really huge help, and thank you so much. Just looking at the chat, somebody mentions, I am autistic. I went to Kirkbride for the vaccination there, where staff were able to vaccinate folks who were more uncomfortable and get them vaccinated quickly. So yes, endorsement for, again, the folks administering these vaccines at all these sites are just wonderful. And they're always, in my experience, when I brought my son, when I went myself, super positive, super easy to interact with, and very, very, very efficient operations. So the link is on the screen for the RIPIN vaccine clinic, the first dose being on June 19th. I've also put it in the chat here on Zoom. If you're looking at us on Facebook and on YouTube, we're going to share the links with you there. You can go to the RIPIN website and find the links. Lots of ways to access it. Please do take a moment to sign up and get vaccinated, and yeah, get back to everything that we're talking about with that new normal, and starting to get out and do fun things that we can look forward to again. Not seeing any other questions, so I think we can go ahead and begin to wrap it up. On behalf of RIPIN, I really want to thank Dr. James McDonald for being here and presenting this information. I want to thank you, Brooke Lawrence. Thank you, Tracy from the RIDOH Youth Advisory Council, and also Alicia from the Youth Advisory Council, and all of our Youth Advisory Council members today. Thank you for your help in putting this together. And thank you to our audience for joining us. If you need any more information about this, again, you can visit the RIPIN website or the Rhode Island Department of Health website. Visit vaccinateri.org. Thank you again. Enjoy the rest of your afternoon and stay safe.
Thank you, everybody. Have a great day.